Hello and welcome everyone. It's great to have you on board for another instalment of the MLA Productivity and Profitability webinar series. My name is Courtney Cheers and I work with the webinar series co-organisers, Aggregate. This series is designed to deliver on topics that are pertinent to the sheep and cattle producers in relation to the productivity and profitability of their businesses. These webinars are recorded and can later be accessed on MLA's website. The title of tonight's webinar is Pink Eye in Weaner Cattle and will be presented by our guest speaker tonight, Lexi Leonard, who is a large animal vet based in Hamilton, Victoria. Bit of housekeeping tonight before we get started. For those that aren't familiar with the webinar platform or just need a refresh, the control panel you can see to your right is able to be opened and closed using the red arrow so you can enjoy the full screen presentation. You should be able to hear us, but we can't hear you, so I'd encourage you to use the questions box in the control panel to communicate any questions you have during the presentation. Please make sure that your questions are as clear as possible so that we can address them with relevant responses. When you log out of this webinar, there'll be a survey that will pop up for you to fill out. I'd encourage you to take the time to fill this out. The feedback we receive from this survey is important to the continuation of this webinar series, as it allows us to address whether we're hitting the right topics for you. So let's kick off the webinar for tonight. As I said before, we have Lexi Leonard from Livestock Logic. Lexi is a veterinarian working in both the beef and sheep industry at both a clinical and farm advisory role. Lexi is focused on helping producers to increase their productivity through best practice animal health management. As well as this, for the past 3 years, Lexi has been delivering a heifer management course to students through the Rural Industries Skills Training. We are very fortunate to have someone with so much expertise in this area presenting tonight. So with that, I'll switch over to you, Lexi, if you're ready.
Yep, I'm ready. Okay. Hi, everyone. As Courtney said, my name's Lexi and I'm a large animal vet at Livestock Logic, presenting on pink eye in weaner cattle this evening. So the structure of this talk is I'll go through the talk and then at the end address everyone's questions. But feel free to pop them in the chat box as you think of them, and Courtney will have a look at them and we'll go through them at the end. So what we will be focusing on tonight is pink eye. So we'll start with what is pink eye exactly and how to identify it, the causes and the risk factors for pink eye, the treatment options that we have available, and also the prevention strategies to try and stop it from happening at a significant level in our herd. So to start with, what is pink eye exactly? It's the term that gets sort of thrown around a little bit, and it covers a couple of different disease processes in cattle. So the technical term is infectious keratoconjunctivitis, and what that refers to specifically is the infectious pink eye, which is caused by the bacteria Moraxella bovis and boviculi, and a couple of others as well. It does also encompass traumatic pink eye, which is obviously traumatic in nature and it doesn't have a infectious component, so it doesn't get passed around from cattle, but can definitely affect weaners quite severely and has the same production losses as the infectious cause of pink eye. So just a bit of a brief image on the left, pink eye signs from mild to severe, starting from 1 to 4. So depending on the causes, which bacteria or viruses are involved, and also the risk factors that are involved with the disease as well, you might see mild to moderate pink eye, which are the two images up the top, moving on to the more severe form down the bottom, number 3, which is severe ulceration and essentially pus in the eye, which can then lead on to rupture of the eyeball itself, which is the number 4 picture. So what to look for when you're looking for pink eye in weaners. The mild to moderate forms can be a little bit tricky to spot, but it's really where we should be focusing our sort of our attentions to when we are looking for pink eye, because it's the best time to try and treat it when it's mild. So when it's relatively mild, what we'll often see with animals in the paddock is weaners seeking shade wherever they can find it, separate from the mob, looking irritated. Pink eye does tend to appear in poor weaners more often than well-nourished weaners. So anything that's in any weaners that that look like they're the tail of the mob, or that have arrived on property and don't and look a little bit stressed or not well nourished, they're the ones that are most likely going to arrive with pink eye, or that will develop pink eye as they go through. So that's where we should be focusing our attentions when we're looking for it in the paddock. So clinical signs when we're looking for it in cattle can, like I said, range from mild to severe. These are sort of some of the milder forms you might notice with animals when they're coming through the yards or in the paddock. But definitely this is the best time to try and pick it up so we can treat it most effectively. So the classic signs of pink eye starting are swollen eyes and cattle that are blinking a lot, and also the tears streaming down their face, which are generally quite obvious in white-faced cattle, not so obvious in Angus. But anything that's causing excessive tear production is some sort of irritant, which can then be a precursor to full-blown pink eye development. Flies, as most people will know, are a quite common spreader of pink eye. So lots of flies hanging around the faces of weaners can be both a sign that there is irritation present in the eye, and there is already a lot of tear production which will attract flies. And that will also mean that those flies are able to spread the bacteria if it's present in large numbers to other animals. So checking for large numbers of flies hanging around is also a sign that something needs to be done with the weaners. So what actually causes pink eye? So I've split the causes into the actual bacterial causes of pink eye, and then the risk factors which will increase the likelihood of pink eye occurring in your mob. So the Moraxella bovis bacteria is the classic pink eye causing bacteria in cattle. It's the one that we've known about for a very long time, but there are a few other associated agents as well. So I've listed them on the left. There's Moraxella bovis, Moraxella boviculi, which is a sort of newer bacteria we've started finding in the last few years. Moraxella ovis, which is classically the sheep pink eye bacteria, but we are finding that more and more associated with cattle pink eye. And as well as a couple of Mycoplasma species have been found recently as well. So all these bacteria have been cultured from pink eye lesions in the Hamilton district, but all across Victoria in the last couple of years. So they are all causative agents of pink eye. And it's important to note that these bacteria are all part of the normal cow microflora. So they don't turn up in vermin or birds or any sort of other animal. They are already part of the cow, in the cow's eye, and also found in cattle feces as well. So we know that these bacteria cause pink eye when there are the appropriate risk factors. So the pink eye disease, what the disease is really is the bacteria being present plus the appropriate risk factors being present, plus susceptible animals being present. So when we're focusing on prevention, we know that we can't prevent the bacteria from arriving on our property because it's already part of the cattle microflora. So we really need to focus on removing or decreasing as many risk factors as possible, and decreasing the susceptibility of our animals. So moving on to the risk factors of pink eye. So these are many and varied. So I'll run through the more common ones that we see causing pink eye in weaner cattle specifically. So UV light, flies and dust are the three classic risk factors associated with pink eye, and the three most common causes we see associated with pink eye outbreaks. And these generally coincide with when a lot of cattle are getting weaned, so that just helps create a high risk factor environment for pink eye in weaner cattle. What these three risk factors do essentially is cause mechanical irritation to the eye, which will then decrease the eye's natural immunity and allow the Moraxella or the Mycoplasma bacteria to multiply and cause the pink eye disease. As well as flies and dust can act as mechanical transmitters of the bacteria from one animal to another. So if we have one or a small percentage of a mob that's highly susceptible to pink eye, they can grow large amounts of those pink eye bacteria that can then be spread by flies and dust and close contact to other animals in the mob, and those animals' immune systems can then become overwhelmed by large amounts of the bacteria, and then they can develop pink eye as well. And some more risk factors that aren't necessarily as common as flies, dust and light, but definitely still quite important that we see in outbreaks. So mechanical irritation to the eye is also a really important risk factor. We mostly see that in southwest Victoria, at least, being caused by pasture, long rank pasture, straw or really stalky hay that's being fed out, and also thistles and other weeds over the summer period. So weaner cattle, if they're on pasture, generally like grazing quite close to the ground. So if they're in paddocks that have quite long rank feed, they will preferentially graze closer to the base of that feed. And while they're doing that, they have quite a high risk of grazing or irritating their eyes with the longer stalks and seed heads, as well as they're searching through the pasture to graze close to the ground. So minimize or managing pasture, so weaner cattle are put on shorter green pick or minimal amounts of long dry feed will help minimize the amount of irritation that's present. Social stress and transport stress are two quite common stress factors for weaner cattle that sort of come together, or any sort of stress will impact on weaner cattle to decrease their immune system, and that will then allow Moraxella bacteria to overgrow in their eyes and cause pink eye. So I think these sort of physiological stress factors are often, well, they're quite easily overlooked in the weaning process with cattle, mainly because they're not things we can physically see. But social stress is rated as one of the highest physiological stress factors for weaner animals, so sheep and cattle, and can cause quite significant dips in the functioning of their immune system at that time. So we know that weaning stress is quite significant, being separated from their mothers. but almost more than the weaning stress, that the social stress that comes with weaning, of those cattle having to redevelop their own pecking order and work out their place in the mobs that they're put in, creates quite an amount of stress on their immune system. Transport stress sort of goes hand in hand with that, plus time off feed, and heat stress that might come into it if they're being weaned over very hot periods in summer, all combined together to really put a big dampener on their immune system. Nutrition is also really, really important and basically ties in with the social and transport stress. Cattle that are well nutritioned can handle weaning stress and social stress much better than cattle that are lacking in nutrition. Cattle that are lacking in nutrition will also have less excess protein and energy to put into a highly functioning immune system. So nutrition is super, super important, both for how cattle can get through weaning with minimal lack of production, but also how much they can handle stresses that we place on them at weaning time to then get through with minimal disease processes. And it's a really common thing that everyone probably sees with weaner cattle, often going through yards. They have a lot of social stress in yards, transport stress, stock handling stress, and very commonly can arrive on new properties with a small tail, with pink eye, and ringworm is another classic sort of stress disease we see in weaner cattle. And generally, if it's only a short period of stress and they're well nutritioned and there are minimal risk factors in the meantime, that sort of pink eye situation can be gotten on top of quite quickly. But it really depends on the management prior and after weaning. Trace mineral deficiencies can also tie hand in hand a bit with pink eye, and mainly the factors that come into that is trace mineral deficiencies can contribute to a low or a poor functioning immune system, which will then allow pink eye to take hold in a mob. The most common minerals we see in southwest Victoria and sort of northeast Victoria as well being deficient is selenium, and also occasionally copper can be deficient as well. Generally, these aren't very obvious clinical deficiencies, but can be subclinical, which will just cause a bit of a dampener on immune function, and then lead to sort of low immunity type diseases like pink eye. And as well, IBR and herpes virus infections concurrently with other risk factors have been implicated in propagating pink eye infections as well. Very occasionally we see them by themselves causing quite severe pink eye problems, but they're usually in conjunction with poor nutrition and weaning stress, leading to pink eye infections. Some more pictures to illustrate some ideas of how not to feed weaners in paddocks. So the picture on the top left shows some cattle grazing in really sort of tall pastures with a lot of seed heads, and that's quite a high risk scenario for grass seeds causing mechanical trauma to eyes, which can then lead to pink eye outbreaks, but also secondary infectious pink eye outbreaks, which can then go through mobs quite quickly. Thistles can also cause a lot of problems as well. It's the same issue with mechanical trauma. And one of the big differences you can see with grass seed or mechanical irritation type pink eyes compared to the classic contagious pink eye is with this weaner on the bottom left is you'll often see sort of quite puffy, cheesy pink eye discharge from eyes rather than clear, really clear discharge, but the rest of the signs are generally quite similar. They can have swollen eyelids, holding the eyes shut, seeking shade, lots of flies hanging around, and one can lead to the other, so they're definitely worth trying to keep on top of. So moving along to treatment options for pink eye. There are quite a few options available for treating pink eye, and I don't think any one as a blanket rule is better than another. They're quite often best used all together, but depending on the causes for the pink eye outbreak and the availability of yards and treatment facilities, it really needs to be quite a tailored approach as to what will work best on your property for your mob, and sometimes even year on year, the outbreaks can be quite different. So the options for treatment are, the first ones are physical barriers for the eye that are affected, which are really, really effective even when used by themselves. So they protect the eyes from further irritation from sunlight, dust and flies, etc. They also then will create a really good healing environment for the pink eye infection just by creating a physical barrier. So tears, eye tears and tear fluid has a lot of immune and healing promoting factors in itself. So if you can create a really good physical barrier for that eye, sometimes mild to moderate cases will heal up without further need for treatment. So patches, which I'm sure a lot of people are really familiar with, are really great for mild to moderate cases. And surgical closure of the eyes are really good for moderate to severe cases. So anything that has quite severe pus present in the eye or ulcerations that might look like they're close to rupturing, surgical closure of the eyelids is really the best physical barrier for those ones rather than patches. The other option for treatment is antibiotic therapy, and there's quite a few options for these as well. I've just sort of listed here some of the more common options that are used for pink eye treatment. So there's quite a variety of eye creams available that usually work out to be about $2 per eye. Long-acting systemic antibiotic injectables. So the example I've got here is long-acting Alleemycin, which costs about 30 cents per mil. So depending on what size weaners you're treating, it can sort of range from $3 to larger weaners or adult cattle might be closer to $10 per dose. The way the long-actings work is for oxytetracycline-based antibiotics is they are actually excreted in the tears. So they will give sort of 3 to 5 days worth of antibiotic therapy through the tear production in the eye, as well as just reducing the total bacterial load in the whole cow, which will reduce the amount of bacteria that's put out in feces as well to be spread around. The other option for antibiotic therapy is subconjunctival injections. So I've got a photo of that on the next slide, and they, depending on what particular sort of antibiotic and pain relief cocktail is used, they cost somewhere around $7 per eye on average. Pain relief is also another really important component of treatment, and depending on exactly which pain relief you use, the cost can vary a fair bit. What I've put here is a meloxicam based pain relief, which is about $1.70 per mil, and it's a 3-day acting. Pain relief is really important for getting these weaners back up and on their feet and eating and putting on weight again after a pink eye outbreak. The main production losses we see associated with pink eyes are weight loss or lack of weight gain due to pain from not eating. So pain relief is really important, and there's been quite a few studies that prove that pain relief in conjunction with other treatments definitely gets the cattle back up and productive again in a faster time period. And as well as those treatment options, treatment really needs to be combined with some prevention to prevent further cases from occurring. So this is some photos of a few sort of more surgical treatment options, or veterinary treatment options. So the top one is a temporary tarsorrhaphy, which is where the eyelids, or the third eyelid, is actually sewn over the affected eye. And it's a really fantastic way to help severely ulcerated or ruptured eyes heal over. And generally with if those are done early enough, you can get full or almost full healing of the eye with minimal scarring. The efficacy of the surgical options really depend on how quickly they're done in relation to the severity of the ulcer or the rupture of the eye. When eyes when eyeballs are ruptured completely, and there's already a lot of scar tissue or drainage of the eye fluid, then generally a total eye ablation is needed. So that's when the whole eye, the whole affected eye, is removed, and the cost of that's usually around $200. And their untreated cases have, if there's any sort of rupture or severe ulceration, probably 30 to 40% of those cases will lead to some sort of permanent scarring or glaucoma, which is where the eyeball gets really, really large, that require a total eye ablation. The bottom pictures are just some examples of subconjunctival and subscleral injections of antibiotics, which are done by veterinarians. So they work by creating a sort of long-acting depot of pain relief and antibiotic therapy in the conjunctival or under the sclera of the affected eye. Okay, so moving on to some prevention strategies. So these are, again, a bit like the treatment option. There's lots of different prevention strategies that you can utilise for decreasing the amount of pink eye. I'm going to run through a few here, but there's definitely no sort of perfect blanket recommendations. Every property is going to be quite different in their individual needs, and that'll be based around your yard, your timing of weeding, the weather, the year, and all those sort of factors. But they essentially aim at addressing the risk factors that I spoke about earlier, to try and minimise those risks, to minimise an outbreak. So the two sort of number ones are fairly straightforward. We want to minimise dust and minimise flies, because we know they're the two main spreaders of the bacteria amongst mobs, and they're also the two main causes of irritation among mobs. So minimising dust can be done in lots of different ways: hosing down yards before you work your weaners in them. If you do have the option, trying to work weaners on days where it's not really hot and there isn't going to be a lot of dust production, working weaners early in the morning before or not on windy days. Again, trying to minimise dust. Minimising flies is almost like a whole nother webinar in itself, but one sort of way that works really well for minimising flies hanging around weaners is using some sort of fly repellent on them at weaning time, because we know weaning time is one of the highest risk periods, because they'll be experiencing a lot of those other stress factors. So we want to try and minimise flies for that period to help them get through that weaning time. So products like Demise or Cooper's Easy Dose can be quite handy to provide some good fly repellent for a couple of weeks while they're at their most exposed stress-wise. Good yard hygiene is really important for both minimising fly and dust, but also just minimising the amount of poo and other crap that weaners can stick their heads into and get all over their heads. Stock handling skills are really important, and that comes back to minimising stress, transport, and sort of yarding stress that comes with weaning. it's also really good just to set your weaners up in general to make sure that they know how to move through yards quietly. They don't bury their heads in under each other, which will increase their chance of getting fecal contamination over their heads and into their eyes, and also reduce their stresses over their life. Reducing social stress and co-mingling around weaning time. So I guess this is something that's always said because it is such a huge risk factor for decreasing immunity and causing pink eye, but it's definitely easier said than done. But reducing social stress and co-mingling, it's really about trying to reduce those factors in the really high risk period for weaners. So over the 2 to 3 weeks after weaning, or the 2 to 3 weeks after introducing new weaners or young cattle onto your property, if you can reduce the commingling and social stress in that stage, it'll just allow those animals to have their stresses spread out over a longer period rather than having them all at once, because it's often the sort of all at once stress risk factors that can explode into a big pink eye outbreak. Adequate nutrition, I can't talk about that enough. Essentially, weaners that are well nutritioned prior to weaning and after weaning will have a much more robust immune system and will be much more able to cope with all the other stress and risk factors that come their way. And again, as I spoke about before, having appropriate pasture length for weaners is really important to help minimise that potential pasture irritation at grazing time. And if they're not being weaned onto pasture and they're being weaned into containment zones or sort of feedlots, really thinking about the way that you feed out roughage and hay and straw to try and minimise the amount of irritation that might be causing them by delving their heads deep into bales of straw. I've just made a note down here about winter pink eye because it's something we're seeing more and more commonly, at least in the southwest of Victoria. So winter pink eye is most likely caused by Moraxella boviculi rather than Moraxella bovis. But apart from that, it's really difficult to keep on top of because it often happens obviously over winter where there's minimal dust, minimal flies, and all those things. So the classic things we think about with pink eye, causing pink eye, like flies and dust and sunlight, don't tend to happen over winter. But often they are associated with nutritional and worm stress outbreaks. So it's just highlighting that if you're getting a lot of winter pink eye outbreaks, that some of these prevention strategies might not seem so appropriate, but definitely coming back to that adequate nutrition and minimising any sort of worm stress is super important to keep their immune systems nice and robust. And I've added a picture of some dung beetles here. So dung beetles are fantastic, obviously, at cleaning up feces, which comes back to helping minimise flies and keeping yard hygiene pretty good and pasture hygiene, as well as obviously doing a great thing with helping out with everyone's worm control. Okay, so coming to the vaccination option. So this is another option for prevention and minimising risks for pink eye. So there's a commercial vaccine available, which is Piligard for pink eye, and it will vaccinate against the Moraxella bovis strains, but not Moraxella boviculi. So Moraxella boviculi is a little bit of a new bacteria on the scene. We've only sort of started culturing it in the last couple of years in any sort of significant numbers, but it's probably been around for a fair while. It's just no one's really had a real look for them. There is a bit of talk about autogenous vaccines for pink eye, which can be made based on individual farm culture results, and they can get made in a couple of labs that will make them specifically for your farm. We've had a bit of experience with them. They're very much in the trial and development stage, so we don't really have any sort of real results for how they're going to go. But they are a potential option for properties that culture high percentages of Moraxella boviculi bacteria in their pink eye outbreaks, because there isn't a commercial vaccine available at the moment that will vaccinate for Moraxella boviculi. So just talking really briefly about the vaccine. Vaccines are great, only when they're used appropriately. So the Piligard and the autogenous vaccine, they take about 3 to 6 weeks after the vaccine dose to develop immunity. And the pink eye disease has an incubation period of up to and around 2 weeks. So with that being said, it means it can take up to about 8 weeks to see results for the vaccine to sort of decrease the amount of pink eye that we see in a mob. So what that means is vaccinating in the face of an outbreak doesn't work. It won't help decrease the amount of pink eye you see for around 2 months, which is where I think a lot of people potentially go wrong with it. Is it really needs to be given before the anticipated pink eye season or before the anticipated risk period, and ideally 3 to 6 weeks before that risk period, to get the full benefit of a vaccine. The vaccine itself will work for about 5 to 6 months. It'll give high efficacy for about 5 to 6 months. And definitely mobs or at-risk animals can be given a second dose after this period to extend the protection if there's a second risk period expected, which is definitely what we're finding in Victoria when there's a primary risk period over sort of late spring, and then often a secondary risk period in March and April when the majority of the fly wave comes through. So on those properties that have at-risk animals in autumn as well, it's definitely worthwhile giving a secondary dose, sort of that January, February period. So prevention strategies, it's really important to focus prevention before the high risk period. There's no point sort of doing it all at the time of the high risk period or 2 weeks after, when you've started to notice some cases pop up. Once you've noticed cases pop up, it's sort of too late. You're already in that potential pink eye phase. And the high risk period we really define as high risk management factors plus high risk environmental factors plus susceptible animals at that time. So minimising the high risk period is about minimising those management factors, or identifying those high risk management factors that are going to cause those risk periods, identifying high risk environmental factors, and then trying to reduce susceptible animals at that time. So the main production losses that we see associated with pink eye are weight loss or lack of weight gain, as I spoke about before, and also loss of potential markets for your weaners is becoming more and more of a major implication for pink eye, with feedlots and sort of finisher buyers getting quite discerning about not purchasing weaners that have pink eye scars in their eyes. So we're finding that's becoming more and more of an issue post a pink eye outbreak, which is why it's super important to try and control it before, rather than just treat it as it pops up. So in summary, yeah, unfortunately, there's no silver bullet answer for pink eye. It's definitely a multifactorial disease, and it requires a multifactorial prevention approach and treatment approach. And the biggest advice we give to producers is be prepared early and be really decisive with your prevention and treatment action, because days matter with pink eye to getting on top of the disease. And farm-specific prevention plans are gold standard. So there's no one blanket approach that will suit everyone, because every farm is different, every weaning system is different, and every weaner management system is different. So you really need to develop a farm-specific plan, and farm-specific cultures from Pink Eye, if it's a real problem on your property, is the best place to start for developing advice based around prevention and vaccination schedules. So that finishes my part of the talk for this evening.
Yeah, great. Well done. Thanks, Lexi.
And if there are any questions.
Sorry. Yeah, so thanks so much for that talk on how we can diagnose pink eye and then manage it going forward. I like the point that, you know, it is a multifactorial disease and therefore your approach must be tailored as such. So before we get into some questions, and we've got actually quite a few coming through, so if you'd like to get one in, make sure you type it in now so we have time to answer it. But as I'm aware, some of you might want to take off early, so I'd ask that you just please fill out that survey as you exit the webinar. This survey is shared with MLA and the presenters to help improve the extension efforts and make sure we're targeting the right topics for you. And just a quick note that the next webinar, I think it'll be in about 2 weeks' time, will be presented by Dave Crowley from Delta Ag on the topic of phosphorus in mixed farming enterprises. So to wrap up tonight, let's kick off with some questions for Lexi. James has asked, have you found any of the bacteria strains to be resistant to any of the treatment options? And that sort of tacks onto one of my questions, which was, do you need to know what strain you've got to then be able to choose what vaccination or like treatment antibiotic that you use?
Okay, so we haven't found any strains that we've cultured to be resistant to any of the antibiotics that we recommend or use. What we generally find is the most common cause for treatment failure is inappropriate treatment or non-timely treatment. So people treating cases that have become moderate to severe with just an eye cream or just a patch, or even, you know, they'll give long-acting systemic injectables to cases and they'll only get, you know, a 60% response rate. It's usually because they're treating animals inappropriately. So antibiotic treatment by itself works really well for mild to sort of moderate cases. But to get the best response, it really does need to be combined with physical barriers, whether that's patching or surgical closure. Moderate to severe cases really should be separated from other animals, and fly control is really important as well. So that's the main reason we see sort of treatment failure, so to speak. Culture, so farm-specific cultures are really important when deciding how effective you expect vaccination options to be rather than treatment options. So the Moraxella bacteria, there's no reported resistance in the Moraxella bacteria to either the eye creams or the long-acting injectables. Mycoplasma bacteria is innately non-susceptible to a lot of cloxacillins, which are what the eye creams are. So they don't tend to respond as well if there's mycoplasma bacteria present compared to physical barriers plus long-acting injectables. But that's not to say they don't work 100% by themselves. But yeah, cultures are generally best for identifying best practice prevention for the following year rather than advising us specifically on treatment options.
Yeah, okay, great. Thanks, Lexi. So in terms of, I guess, getting on top of things before they do get to that more severe case, how quickly would you expect the animal to go from that 1 to 4 rating that you put up at the start?
Yeah, so that can depend definitely on what type of bacteria is present, what other risk factors are present, and how much sort of fly and dust irritation there is. But it can definitely happen as quickly as 2 to 3 days if it's quite an aggressive strain of Moraxella, or if the weaners are particularly susceptible, poor immunity, and especially when it's combined with mechanical trauma from grasses or grass seeds. So it can be quite quick, and it also can be, you'll get a mob that gets 5% with just sort of stage 1 pink eye, and then that they get over that by themselves with no treatment. So it really depends more on the animals themselves and what other risk factors are present when deciding whether to bring a mob in to treat versus what exact bacteria is present.
Right, okay. Well, it reinforces that point that you need to be quite prepared and ready to make that decision as soon as you can.
Yeah, again, unfortunately, there's no blanket advice that will suit everyone. They really are always quite a tailored approach. And what we find is people get the best response when they work in conjunction with their vet to identify those risk factors that are present, so they can work out what treatment, sort of the speed of the treatment, and what treatment is going to be most appropriate for them. And most of the time, a property will have the same risk factors and the same animals year on year, so they can develop quite a good plan that works for them every year. That may just need a bit of tweaking depending on the amount of rain and the amount of pasture present. But what might work for my weaners won't work for the farmer next door, because he'll be running a totally different system to me, and have different risk factors present. So it's really about identifying the risk factors present on your property, and culturing of the bacteria that's present on your farm is one way to help identify the risk factors that are present, because we do know some bacteria will cause disease a lot faster than others, but it's definitely not a hard and fast rule.
Yeah, okay, great. Thanks, Lexi. We've got quite a few questions to get through, so that's great. Thanks for everyone sending them through. Kate's asked, have you seen any success with adding garlic powder at 2% of the total mixed ration at weaning or confinement feeding? Kate's read that the smell of garlic in feed and their breath deters flies.
So I have heard this. I haven't read any studies that support that particularly. So I guess I'm not really informed enough to make a comment.
Sure,
we don't have any clients that are doing that specifically.
Cool. Yeah, no worries. All right. Thanks for that question, Kate. Faye just wants to confirm she was under the impression that Cydectin was the drench that did not have much effect on dung beetles.
Yeah, so it does. It can.
Yeah.
So it definitely can. Some dung beetles, I believe, are more or less susceptible to different drenches, but any of the Mectin drenches are insecticidal, so they will kill insects. And because the Cydectin has a persistent action, it is more likely to be excreted in feces, so it's more likely to be taken up by the dung beetles.
Yeah, okay. Well, thanks for that explanation. John has asked that you've noted pink eye bacteria or mycoplasma, etc., are naturally present in the animal. Are there any animal types which might shed higher levels of this bacteria or microplasm, i.e. reservoirs? What are the pathways, in addition to eye fluids, by which an animal releases this bacteria, and how is it transferred to other animals? Should we be considering culling animals that had pink eye?
Yes, good question. So yes, the bacteria are naturally present. Animals that have poor immunity will shed much higher levels of the bacteria. Um, I'm not aware of any sort of studies that show that there are sort of animals that will always shed more bacteria than others. But essentially, weaners with a lower immunity will shed more bacteria. It's shed in eye fluid and also feces as well. But I wouldn't necessarily. There is discussion about being maybe a genetic component, that some animals are more or less susceptible to pink eye based on genetics. But I think that needs a little bit more looking into. So at this stage, I wouldn't recommend culling animals based on them having pink eye, but definitely animals with active pink eye lesions will be shedding huge amounts of the bacteria to others, and it gets transmitted by that eye fluid. So close contact with other animals will move bacteria. Flies transmit bacteria. It can also be transmitted in dust or in dust particles, and sharing enclosed spaces like weaning yards, feed troughs and water troughs will spread the bacteria around quite quickly.
Yeah, okay, great. Thanks for that question, John. Mark's asked, what's the best eye patch?
I think the best eye patch is an old pair of jeans, because it's nice and tough, and it doesn't let any light through. And some like Sally's liquid nails is really good at sticking it on to the cattle spaces.
Yep, great.
So what with the patches, yeah, what you're really aiming for is to make a dark enclosed environment. And old ripped jeans seem to work a treat.
Yeah, perfect. So Helen's asked, what age can you give the vaccine to young stock?
So you can give it, I think the exact age on the packet's like 8 weeks or something, but you can give it at marking time if you're marking animals into a high risk period.
Yeah, okay, great. And Dominique's asked, does terramycin spray work well?
Brilliant question. I actually forgot to mention this. Terramycin spray is not good for pink eye. It's essentially the aerosol in the spray is a severe eye irritant, so you'll essentially just make the problem worse. Same with terramycin powder. The powder is really irritating to the eye, so you're just essentially adding to the problem because you're introducing a source of severe irritation. And the level of antibiotic present in the terramycin spray isn't enough to actually treat the disease in any significant way. So, yeah, terramycin spray, please don't use that. You'll just make the problem worse.
Yeah, great. Very good message. So Hugh's wondering, what labs do autogenous, I'm sure I probably said that wrong, vaccines?
Autogenous vaccines. So the lab that we have used in the past is ACE Labs in Bendigo. And they make quite a lot of autogenous vaccines, and they've done a bit of autogenous vaccine creation for us recently as well.
Okay, yep, cool, thank you. Thanks for the question, Hugh. John has asked again, can you comment on the effectiveness of antibiotics on treatment of the different bacteria, i.e. Bovis, Boviculus, etc.?
So what we find is the effectiveness of antibiotics tends to be more related to the severity of the eye lesion rather than the specific bacteria. So if you've got mild to moderate lesions, which are usually caused by Bovis, but also Boviculi, eye creams work really well for that. And then if you've got more moderate to severe lesions, the long-acting injectable will work better than eye cream by itself, rather than specific bacteria, except for mycoplasma. Mycoplasmas are innately quite resistant to the cloxacillin-based eye cream, so they do respond better to long-acting injectable oxytetracyclines or other antibiotics rather than penicillins.
Okay, yep, righto. So Jan has asked, what are your views on vitamin A and vitamin D deficiency? Does it have a role to play in pink eye, or can it be used as a possible treatment?
Yeah, so vitamin A deficiency has been implicated in contributing to pink eye. And the way it does that is vitamin A is really important for animals to produce mucosal immunity, which is the antibody production on mucosal surfaces like the conjunctiva of eyes, the inside of the nose, the gums, etc. Vitamin A deficiency is very, very rare. In fact, I don't think it's ever been reported in Victoria, at least. It has been reported a bit in northern New South Wales and southern Queensland following the droughts. It essentially, you need to have a lack of green feed for over 12 months to create vitamin A deficiency in cattle. And that includes any sort of greenness in hay or silage. So those sort of situations very rarely arise in Victoria, but they might on a local area or on an individual farm level. So if you think you have vitamin A deficiency, you can get tested for it and then treat it as appropriate to help minimise pink eye.
Yeah.
And vitamin D, I'm not sure about vitamin D deficiency. It's pretty rare in cattle and sheep in Australia because they get a relatively large amount of sunlight.
Yeah, okay.
Which is how vitamin D is.
Great, thank you. Keith has asked, with subconjunctival injections, is there an indication to use penicillin and short-acting corticosteroid? Sorry, I've said that wrong.
Corticosteroid?
Yes, that's right. Is it best is it still best practice, or is there a better antibiotic choice for corticosteroids?
So corticosteroids are a really great anti-inflammatory choice for subconjunctival injections. The main reason we wouldn't use them would be in pregnant animals because they can induce abortion or fetal loss. So they're not great choice in pregnant animals, but for weaners they can do a really good job and provide quite strong anti-inflammatory effects. So the antibiotic choice is usually down to sort of almost veterinary preference and history of what tends to work really well on that certain property, but it often is either a short-acting penicillin or a short-acting oxytetracycline based antibiotics, and plus a corticosteroid.
Yeah, okay. Thank you. Tim has asked, what do you do with patches and surgical eye closure if the moderate, severe or to severe infection is in both eyes?
We patch them both or sew them both shut, because if they've got a moderate to severe pink eye lesion, they're effectively blind anyway. So they really can only see light and dark through that amount of inflammation and pus in the eye. So the best thing for them is to give them appropriate timely treatment, and just have them in a yard or while they are patched or sewn shut. For most moderate lesions, patching or sewing their eyes shut for sort of 5 to 7 days will give you a 60 to 90% improvement. So it's not a super long period of time that they need to be closed shut for. Severe cases definitely need a little bit longer, but it's it's not weeks and weeks on end.
Yeah, okay, great. That's answered a few questions. Some people are wondering how long eye patches should remain in place, and again, the question of how to handle blind weaners with an infection in both eyes. So we'll move on to a question from, sorry. We'll move on to a question from John.
I was just going to say, yeah.
You go, sorry, Lexi. What was...
Yeah. Oh, sorry. I was just going to say that handling blind weaners is there's no easy way to do it, and it is really hard. But if they're blind in both eye from pink eye lesions, the best thing to do is treat both lesions as soon as you find them, not treat one and leave the other, and then switch over.
Yes, okay, great, thank you. Yes, we're having some similar questions about that, whether or not an animal is more likely to develop pink eye again, but I think you've sort of already touched on that. Some people have asked, when will a recording be available? Hopefully sort of early next week at the latest, but it will be on the MLA website. And so I've got a question from Damien. Can the pink eye that's actually caused by a trauma still be spread to other animals?
So no is the short answer. So if you have a pink eye case that's caused by a grass seed or a stab to the eye or something like that, then that case is not infectious in cause. Depending on the risk factors and the animal susceptibility factors that we spoke about, fighting factor for the Moraxella bacteria to start growing and overproducing, which then can be spread. But if the rest of your mob is low in susceptibility and there are those other risk factors present, it's very unlikely that it will become an infectious pink eye outbreak.
Yes, okay, yeah, great to know. So I think this will be our final question for tonight from Jen. What role does eye hooding have to play in the role of pink eye?
Sorry, was that eye hooding?
That's right, yep.
Just to clarify, is that talking about the structure of the eye and aiming for more pigmentation in eye?
Yeah, so I'm not sure on the details. So if Jen wants to clarify, she can either send it through now or perhaps contact you later. But yes, as I said, I think that's our last question for tonight. It's been a great presentation. Thanks very much for your time, Lexi, and clearly you have a lot of experience and knowledge on this topic. And for those that were wondering, we will have this webinar live on the website. So Jan's just clarified she means the skin fold over the top of the eye.
Yeah, so that can help with reducing pink eye in that it can reduce the amount of UV irritation that reaches the eye and the conjunctiva itself, which will then reduce the amount of irritation that's present, which can be a high risk factor. So there is occasionally a bit of talk that that light eyes and non-pigmented eyes can be more susceptible to pink eye because they're more susceptible to UV irritation and things like cancer development. But we don't generally see that specifically because the cause of the pink eye from UV irritation is directly to the eye bulb itself rather than the eyelid or the conjunctiva around the eye. So, it may have a role, but it's definitely not as significant role as the other prevention strategies we spoke about.
Yeah, of course, of which adequate nutrition seems to be the key message of the topic tonight.
It's absolutely. It's amazing how many things really, when you boil them down, come back to adequate nutrition and good stock handling.
Yeah. Yeah, no, excellent message. So yeah, thanks so much, Lexi. As I mentioned before, if you're leaving this webinar, please take the time to fill out the survey, and don't forget that the next webinar will be in the next 2 weeks, presented by Dave Crowley from Delta Ag on the topic of phosphorus in mixed farming enterprises. So that's all we have time for tonight. Thank you again, Lexi, and thank you to our listeners for tuning in.
Thank you very much, Courtney.